Hello class! Welcome sa ating online feedbacking ng health, Quarter 4. Ako ang inyong guro, Sir Nick Cruz. Para sa ating objectives sa linggong ito ang mga sumusunod. Una, discuss health career and its component in making a personal health career plan. Ikalawa, check your understanding through answering health module. Ikatlo, appreciate the value of choosing health career through performance task number 2. Let's have a review. Sa ating quarter 3 ay tinalakay ang mga global health issues, trends, and concerns ng mundo. At tinalakay natin ang tinatawag nating Millennium Developmental Goal. Ang Millennium Developmental Goal ay isang goal na nilikha ng 189 countries na tumagal ng 15 taon at inumpisa ng year 2000. Kaya siya tinawag na Millennium. Under ng Millennium Developmental Goal ay 8 goal na pinagkasundoan ng iba't ibang bansa. Ito ang mga sumusunod. Una, eradicate extreme poverty and hunger. Tanggalin o paksain ang kahirapan. Ikalawa ay to achieve universal primary education, kung saan mabigyan ng libreng edukasyon ang bawat isang bata. Dati, tayo ay nasa sistema ng basic education curriculum na sa ngayon, dahil sa ating Millennium Developmental Goal, ay lumipat na tayo o nagtungo na tayo sa makabagong sistema ng edukasyon na tinatawag nating K-12 na ngayon ay tinatamasa na ninyo sa panahon ngayon. Ikatlo, promote gender equality and empower women. So ngayon, dahil sa Millennium Developmental Goal na yan, ay nagkakaroon na ng gender-based equality o pagkakapantay-pantay ng bawat gender. Pati ang third sex, ang LGBT ay nabibigyan na rin ng boses sa komunidad. Ganoon din ang mga kababaihan. Ikaapat ay reduce child mortality o mabawasan ang pagkamatay ng mga bata. Kasi lalo na sa bansang Africa, napakaraming mga sanggol at bata ang namamatay. Marahil na rin ay dahil sa kahirapan. Ikalima, improve maternity o maternal health. Maging mabuti at improve ang kalagayang pangkalusugan ng mga kababaihan, lalo na ng mga ina. 6. Combat HIV, AIDS, malaria, and other diseases. Labanan ang iba't ibang uri ng sakit at karamdaman tulad ng AIDS, HIV, at dito rin pumapasok ang pandemic na meron tayo ngayon under ng number 6 ng Millennium Developmental Goal. Ikapito, ensure environmental sustainability. So paggamit ng mga natural resources at pangalagaan ang ating kalikasan, gumamit ng mga natural resources tulad ng wind energy, solar energy, or hydroelectric energy para magamit natin. Dapat eco-friendly din. At yung ikawalo, global partnership o yung pagtutulong-tulungan ng mga bansa. Kung may hidwaan man sa mga bansa ay dapat mapagkasundo nito na sa maayos at mapayapang pamamaraan. So, ito ang 8 Millennium Developmental Goal na nilikha ng 189 countries sa pamamagitan ng United Nations. At dahil dyan, nabuo rin na tinatawag nating global initiatives o mga programa under ng Millennium Developmental Goal na tumutulong sagutin ang mga problema ng mundo. Na kung saan, matapos ang Millennium Developmental Goal sa loob ng 15 taon, ang lahat ng nasimulan ay dapat ipagpatuloy. At ito ay tinuloy na tinatawag nating Sustainable Developmental Goal. Ang mundo ay sumasailalim ngayon sa isang malaking problema na tinatawag nating global pandemic. At dahil dyan, isa sa mga problema natin ay ang mga sumusunod. Ayon sa balita, there is a shortage trouble of nurses in Cebu hospitals and there are nurses that are gone at sinasabing napunta o na mal-distribute sa ibang careers. Okay? So dahil dyan, nagkakaroon tuloy ng bukod sa pandemic na may problema tayo, kakulangan ng mga frontliners at health workers sa ating panahon na may uugnay natin sa lesson natin ngayon. Sino ba ang kinakailangan sa panahon ng pandemic? Sila ay ang mga sumusunod. Tingnan natin kung kilala natin sila. Number 1, picture. Siya ay nakaatas na mag-perform ng physical exams, taking medical histories, performing and interpreting diagnostic tests, and recommending a planned treatment for the patient. Sino kaya ang picture number 1? Ano kayang career ito? Ito kaya ay nurse? Ito kaya ay nurses? Ito kaya ay physician? O ito kaya ay isang pharmacist? Tingnan natin ang kasagutan. Physician o tinatawag din nating medical doctor. Number 2, pictures. Yung nasa gitna. Sino kaya siya? Kadalasan natin siyang nakikita sa hospital. She or he is in charge for patients' communication and communicating with the doctors. She and he is also in charge in administering medicines and taking of vital signs of the patient. Sino kaya siya? Isa kaya siyang doctor o physician? Isa kaya siyang pharmacist? O isa kaya siyang midwife? Tignan natin kung tama ang iyong naiisip na sagot. Ang tamang kasagutan ay nurses. Marahil tama ka. Okay, number 3. Ang larawang ito, sila ay nagre-respond in emergency situation and assisting in emergency situation and giving CPR or cardiopulmonary resuscitation and bandaging of food if necessary. Who are they? Okay, sila kaya ay doctors? Sila kaya ay nurses? O sila kaya ay emergency medical technicians? Tignan natin kung tama ang nasa isip mo. Kung ang iyong sagot ay emergency medical technician o EMT, tama ka sa iyong kasagutan. Lahat ng yan, physician, nurses, o emergency medical technician, ay tinatawag nating medical or healthcare professionals. Ang medical o allied health professionals ay parte ng tinatawag nating career. Ano nga ba ang career? A career is an occupation or profession that requires special training. Ibig sabihin, ang career ay isang trabaho o kabuhayan o isang propesyon na kinakailangan ng maigting na kasanayan o special training. Kadalasan, ito ay umaabot ng 2 taon, 4 na taon, 10 taon o higit pa. So, napakaraming career na maaari nating pagpilian. Narito ang halimbawa ng career na maaaring tunghihin ninyo pagdating ninyo ng grade 11 at pagtungtong ninyo ng kolehiyo. Maaari kayong pumili sa strand ng ABM, sa strand ng UMS, sa strand ng STEM, at sa strand ng General Academic. Narito rin sa picture na ito ang iba't ibang propesyon o kurso na maaari ninyong kunin sa napiling strand. Ngunit tayo ay mag-focus sa health career. Ano nga ba ang health career? Ang health career is a design to familiarize students with various career of medical profession and allied health services. So ito ay nilikha upang maging pamilyar ang mga mag-aaral tulad ninyo sa napakalawak na propesyon sa medical field at allied health professionals. Hindi nalilimit ang health careers sa propesyon na nakikita lamang natin sa hospital tulad ng doktor o nurses. Ito ay napakalawak at napakaraming pathways ang maaari niyong tunguhin kapag health career ang inyong napili. Narito ang halimbawa ng mga pathways ng health career na maaari ninyong tunguhin kung health career ang inyong pipiliin. Nariyan ang nutrition, maaari kayong maging clinical dietitians. Kung disease and preventions naman, maaari kayong maging community health worker. Kung dental health, pwede kang maging dental hygiene, dental nursing, o pwede din naman maging dentist. Environmental and healthcare management, maaari kang maging air quality monitoring, soil science analysis, o radiological assessment. Kung drug and preventions, maaari kang maging drug enforcement and drug and alcohol rehabilitation na worker. 6 is kung emergency medical services naman, maaari kang maging paramedic o emergency medical technicians. Number 7, kung may kinalaman naman sa buntis o sa mga bata, maternal and child care, pwede kang maging midwife. Number 8, pwede ka naman, kung occupational safety naman ang nais mo, maaari kang maging health inspector or industrial hygienist. Kung mental health naman, ay maaari kang maging social worker, psychology guidance and counseling, or maaari kang maging psychologist or psychiatrist. So, ilan lamang ito sa mga halimbawa ng health career pathways na maaari niyong tunguhin. Ito ay napakalawak at mas marami pa dyan ang maaari niyong tunguhin kung health careers ang inyong kukunin. Next, why pursue health career? Bakit nga ba mahalaga o bakit kaya magpupursue ng health career? Pwede ka naman magpursue ng career sa engineering or sa arts. Pero bakit health career? Okay? So, una, ang dapat natin consider ay good salary. Okay? So, mataas po ang salary ng health worker. Lalo na kung nasa ibang bansa ka. Sa Pilipinas, ang isang doktor, public doctor o medical officer 1 ay maaaring sumahod ng 50,000 and above, while ang nurse 1 o N1 ay maaaring sumahod ng 24,000 and above, depending po doon sa inyong ranking. Next, job security and tenure. Kapag ikaw ay healthcare professional or nasa health career ang iyong tinungo, okay, kapag ikaw ay na-hire sa public o sa pribadong sektor, ikaw ay merong job security at merong job tenure or security of tenure kung saan hindi ka agad maaaring matanggal sakaling magkaroon ng malawakang pagtatanggal sa trabaho. Lalo na kapag bumagsak ang ekonomiya. Bakit? Ang health career po ay isa sa mga necessity na kailangan ng ating bansa upang mapangalagaan ang kalusugan. Kaya hindi agad basta-basta natatanggal sa profesyon ng health career. Next, do work that interests you. So, sabi ko nga napakalawak ng pathways ng health career. So, kung gusto mo sa environment, meron namang kinalaman doon, pwede kang maging environmentalist. Kung gusto mo may kinalaman sa mental health o sa pag-iisip ng isang tao. Pwede kang maging psychologist, psychiatrist, guidance counselor. So, maaari kang pumili dyan. Kung gusto mo naman ay may kinalaman ka sa katawan ng tao, you can be a doctor, specialization on surgery, di ba? Next, find a health career that fits your educational plan. Dahil napakalawak ng healthcare pathways, there are also several na career na pagpipilian mo. Pero dapat syempre, it fits your educational plan kasi the good salary you can have, the more investment that you will have, mas malaking balik din naman yun. So example, you choose to be a doctor, diba? You requires to have a good educational plan for that. Pero sabi ko nga, ang health career or career can be a 2-year course, 4-year course, or a 10-year course. Diba? Ang midwife is a 2-year course. Nurses, pharmacist, medtech, medical technologies are 4-year course. They are the preparatory for a medical doctor. And if you want to be a doctor, that is a 10-year course. So, depende sa healthcare plan mo. So, mas mahaba, mas malaki yung gagastusin mo. So, maghanap ng fitted doon sa budget or sa plan. Next, there is a clear path of advancement. Ibig sabihin, once you become you choose health career, there is a sure advancement for you. From nurse 1, you can uplift yourself into nurse 2, nurse 3, nurse 4, and to a head nurse. Or if you are a doctor, medical doctor officer 1, you can be a medical officer 2, and so on and so forth. So there is a clear path of advancement depending also on your years of services and yung inyong educational background. So kung mas nag-advance ka sa pag-aaral mo, mas mag-advance din yung advancement ng career mo. Next, work with people or not. You may choose. It doesn't necessarily that if you choose health career pathway, ay lagi kang nakikisalamuha sa tao o lagi kang nakikipag-interact sa tao physically or face-to-face. No. You can choose jobs in healthcare pathways just like medical transcriptionist that doesn't have any physical communication with the client or patient. Rather, ang work ng medical transcriptionist is to transcribe all the medical records of the patient. So it doesn't require working with the people, diba? But if you are people-centered na tao at you want to communicate and have a physical contact with people, you can choose to be a doctor or nurses, which is as this time of pandemic, it becomes online too, diba? Next, let's set the component and steps in making health career. Number 1, ang steps sa pagpaplano ng health career. Once you choose the pathway of health career, you should plan. First is self-assessment. In self-assessment, the question is, what are your interests and skills? Or what are your skills and interests? This is necessary to understand one's capability and drawbacks, which involves continuous learning and improvement to build and grow in the chosen career pathway. It is also a way to discover your personal strength through self-assessment, values, interests, personality testing, skills, and etc. So in self-assessment, it is where you discover yourself. Inaalam mo sa sarili mo kung ano ba yung hilig mo, kung ano yung ayaw mo, kung ano yung nagbibigay sa'yo ng interest. Okay. So, you may create a table kung saan ito yung gusto ko, ito yung ayaw ko, saan ako mahina, saan ako magaling. Okay. Mamaya, you choose to pursue health career pathways, you choose to be a nurse, and then mahina ka naman pala sa blood. Pag nakakita ka ng dugo, nahihilo ka na. So, pero meron ka namang ibang strength. Magaling ka sa pagta-transcribe o magaling ka magsulat o mabilis ka mag-type and then records files. So, you can choose other ways of pathways. Pero, nandun ka pa rin sa linya ng health career. Okay? So you should know what you want and what you don't want, what your strength and what is your weaknesses. Learn to discover yourself. That is self-assessment. Next, once you know yourself, your strength and weaknesses, sabi mo sa sarili mo, magaling ako sa science. Gusto ko gusto ko lagi pinag-aaralan biology, human body. So I choose to be a doctor, sabi mo. So you do career explorations. You then explore different careers and work environments through career fairs, online research, meetings, internship, alumni connections, and professional resources. So the question is, what health careers do I want to explore and what I will do to explore the different health careers? Ano nga ba gagawin mo? You can attend job fairs. Sa Philippines, there are a lot of job fairs. And then you can also attend internship or meetings. Okay? So once you know your strengths and weaknesses and you decide what you want, you can now explore your careers. Anong mga career ba ang bagay dito sa akin? Doctor. Gusto mo maging doctors? There are a lot of doctors. 'Di ba? Anong specific dito? You can attend meetings. So you can interview doctors. Kunwari may na-meet kang doctors, you can interview them. What is their specialization? There are doctors specialization in child, that is pediatrician. Doctors specialization in the eyes, you have the ENT, 'di ba? Doctor specialization in the skin, we have the dermatologist. So you can explore, research on your own depending on the interest that you want. Okay? And then you then discover yourself. Saan ka mas best suited dito? Okay? Next, once you nag-research ka na research and know really yourself what you want and what you don't want, you then decide. The third step in making career health plan is decision making. What health career will I choose based on my skills and interests, and what do I need to consider? Then you evaluate and narrow your options and listing the pros and cons and compare your strengths and weaknesses in deciding the career paths that will fulfill your future goals. Ibig sabihin, once you list your strengths and weaknesses, you decide, you research through career explorations, and then you also need to decide na what is the exact career that I want to do or to be part of my life. I want to be a doctor. These are my strengths. What are the things that you need to consider? I want to be a doctor, but I do not have enough sufficient financial capability to sustain my education. That is the things that you need to consider. Kulang, kapos. Anong gagawin ko? Okay. So, kung kapos, maybe I will take the other career pathway. I'll be a nurse, a 4-year course. Kasi hindi kaya ng 10 years eh. So, if hindi kaya naman ng nurse, but you really want to pursue your career in line with the medical and allied health profession, maybe I will be a midwife, a 2-year professional course. Diba? At least nadong ka sa career pathways. So here, you decide. You tinitimbangin mo kung ano yung pros and cons, strengths and weaknesses mo. Siyempre, you always take to consider some things like financial, 'di ba? And at this point, it's either you go this way or you go that way or you go another way. The decision is yours in making your health career plan. Besides, ito yung magiging bread and butter ninyo in your life. Ito yung magsusustain sa inyo para mabuhay kayo. So, choosing a correct and your decision for health career pathway is in your hand. So, better choose a career health pathways that suit your interests and skills. Next is, once you have your decision, I'll become a doctor, sabi mong ganon. Okay? Then, yun then plan of action. Make a plan of action. What will I do to meet my goals? Okay, remember that you need to plan an achievable goal and develop strategies to reach your goals. Organize your goals into smaller steps. Identify actions for each steps. Utilize helpful people and resources. Review and adapt your plan regularly. So, dito sa plan of action, you limit, okay, into specific. Kailangan specific yung goal mo. I want to be a doctor, 'di ba? What are your strategies para maging doctors ka? Dahil nga may problema ka, you considered into the uh, decision making, you consider the financial, you then plan of action by uh, deciding yourself that you will be a working student in college. So, pwede kang habang nag-aaral ka, nagtatrabaho ka. And you also decide, one of your plan of action is you will take a scholarship. Mind you that not all doctors are wealthy talaga. There are some doctors na talagang from rags to riches. So the government offers uh, medical, medical and allied health care scholarship. Kasi nga, kailangan ng government natin at ng bansa natin yan. So, all you need to do is to take the scholarship, and once you pass that, all you need to do is to maintain the grades and then serve the country for several years. I don't know if 3 years or 5 years. Basta magsiserve ka sa country mo, paaralin ka ng gobyerno. Okay? Example, you go for UP. UP, Manila is where doctors and nurses of UP goes. Doon sila nakalagak. So, kung doon ka magte-take ng exam, nakapasa ka doon ka mag-aaral, at you will be having your scholarship. Paaralin ka nila ng libre, ng government. And also, there are also private sectors like the SM na nagpapaaral din. All you need to do is to take your scholarship and they will provide your education in health career. At gustong-gusto nila yan, lalo na kapag health career. Okay, lalo na yung mga nagdo-doctors. Next, always remember that in setting up your career goals, it should be specific goals. Goals must be measurable, kailangan measurable and timely siya. Okay? And always be positive, but realistic. So, gusto mo ganito, pero dapat isipin mo rin kung kaya ba. Sabi nga, there are things to consider. And then, pair goals with action. Your goals should always be reflected by an actions. 'Di ba? Gusto mo maging doktor, pero wala ka namang actions na ginagawa. Hindi ka nag-aaral. So, hindi rin mangyayari yung goal mo na yon. And remember to be flexible. There are times in life that this career requires challenges. Na minsan, kakapusin sa financial, yun laging problema. But then, it requires flexibility. So, kung wala ka pamasay, kung malapit lang, maglakad ka. Mga ganong tipo. As long for you to reach your career goals. Diba? The important is you are moving forward and you feel the wind hitting your face. Nagmo-move forward ka, diba? At you are straight forward to your career. Just like the girl in the picture na kung saan straightforward ang kanyang career. Diba? Ang kanyang goal. Kaya na-reach niya yung kanyang goal. Next is, now that you know the topic for the health career and its steps in making health career plans, you may now proceed to your health module exercises, which is for module 1 and 2. I know for the fact that some of you have not yet answered the module in health. So here is the module in health for week 1 and week 2. So for week 1, the instruction is to list down the words associated with health careers. So, all the words that you may associate with health careers, kindly write it on your paper or print it and then list down the words that are related to health careers. So, you may put nurses, you may put self-assessment. That are some examples. Okay? Then for week 2, you answer the check your understanding. Under the check your understanding, you complete the statement. I learned that career is, I learned that health career planning is, I understand that blank, I will choose a health career blank, I will plan my career blank, and so on and so forth. So, objective naman, ay subjective naman yung sagot nyo dyan. So, definitely, in your week to check your understanding, as long as it's related and within the topic of health career, it will be checked. And you may gain points for that. And then for your week 3 task, you will be having your performance task number 2, which is we then urge you to pass it on this Saturday. So your performance task number 2 is entitled Health Career Promoter for Modular and Hybrid. You are a human resource of a Department of Health and tasked to hire medical allied health professionals in accordance in the increasing needs of frontliners during this pandemic. You then hire a medical and allied health professionals through short video presentation of the applicants. And as a human resource, you will provide a sample of the application process. The following focal persons will evaluate your output: the Secretary of Department of Health, Municipal Health Officer, and the Head of Human Resource of the DOH. So what to do? Anong gagawin ko po, sir? So first, think and choose any allied or medical health professionals which you may refer on your SLEM Grade 10 Quarter 4 module. So merong mga pathways akong pinakita kanina, you may choose on that. And then, after choosing, example, you choose to be a pediatrician, a medical doctors. You then, number 2, search the job descriptions of a pediatrician. Job description or responsibility of the allied healthcare professionals you selected or chosen. So, kung pediatrician, ano bang ang job responsibility ng isang pediatrician? So, you may research for the job responsibility nun. And then, third is to improvise a device or outfit that you may use in your video presentation of your selected medical and allied professionals. Example, kung doktor, pwede ka maglagay ng stethoscope. Example, kung pharmacist, pwede ka maglagay ng test tube habang pinapakilala mo siya. May test tube kang hawak. Okay? Or kung nurse ka, meron kang hawak na logbook or whatsoever na pwede mong pag-recordan. Okay? So, you may use any resources at home in doing your performance task. And then, you may record in any application that you want, provide an edit, an effect, and text or transitions to enhance your output. So, sa video ninyo, ipapakilala ninyo, kunwari napili ninyo ay nurse. Diba? Ako ay si Nurse Nick Cruz. I'm working at, example is Tondo General Hospital, and my thoughts and responsibility are the following. I do blank, blank, blank. I do work with blank, blank, blank. Then you may act or whatsoever that may enhance your output. Okay? Then, once you're done, you may send your output to your MAPE teacher. Note that be creative in presenting your output. You may make use of any resources available at home that may be helpful in your video. So, we then expect to pass your performance task this Saturday. Here an example of a job responsibility or job title of a nurse. So, nadyan yung basic functions niya. Yan, one who is responsible for planning, organizing, coordinating, evaluating, and documenting quality management, integrated nursing wide program designed to monitor and improve the quality and appropriateness of nursing patient care and minimize the risk of nursing practice and potential loss. So that is an example. So you may use that on your video. Okay? You may also search na iba pa. Again, sabi ko, napakalawak ng healthcare pathways. It's just not being bounded to nurses or physicians or medical doctors, there are a lot. Okay? So, kung pinili nyo maging psychologist kayo or psychiatrist, that is still under of health career pathway. Okay, next. Questions to Founder. While having our lesson, kindly answer this on your mind, on yourself. What is the career needed during these pandemic situations? There are a lot of career. When we say career, there are a lot. Diba? There are engineers, uh, architects. But our lesson for this week is health career. So, what career is needed during this pandemic and why? Number two, is globalization has a direct effect on our current situation of lacking medical health workers and why? Globalization is your lesson in AP. Okay? So, is there a direct effect in our current situation? Kung saan yung mga nurses natin ay nagpupunta sa ibang bansa and why? Diba? Next, what will happen if the healthcare will not be promoted or be part of this of educational curriculum? What will be your solutions? So, ano kayang mangyayari kung wala nang kumukuha ng medical or healthcare professionals? 'Di ba? Hindi na siya isasama dun sa uh, curriculum. Tulad ng lesson natin ngayon, hindi siya isasama. What will happen? Will the focus of the students will only be they will get a profession or career in different pathways? Baka lahat na lang mag-engineer. Baka lahat na lang mag-teacher. Baka lahat na lang architect, 'di ba? So what will happen and what will be your solution? Those are the things that we need to ask ourselves. Okay? And for your assessment, for some who have not yet taken assessment summative test number 1, for some, you may take the assessment for number 16 to number 20. Number 16. This is an occupation or profession that requires special training. A, career, B, profession, C, occupation, or D, workers. Number 17. The following are the components and steps in making career plan, except A, plan of action, B, decision making, C, job hunting, or D, self-assessment. For number 18, this is where you decide and narrow down your options to which career can you fulfill your current and future goals. A, self-assessment, B, career exploration, C, plan of action, or D, decision making. For number 19, this step is where you go through different career fairs, online research, meetings, internship, alumni connections, and professional resources to explore. A, self-assessment, B, career exploration, C, plan of action, or D, decision making. And number 20, it is an individual plan to make career choice, growing in the chosen career or making a career shift. A, career planning, B, career, C, professional growth, or D, professional development. So once you answered summative test 1, on the link also given to you by your MAPE teacher, send the screenshot of your result to your MAPE teacher. So, lesson learned for this week on health is choose a job you love and you will never have to work a day in your life. So, better choose a job that you really love, that is your interest and skills, and you will never feel to work for a day. Kung gusto mo yung ginagawa mo, mag-e-enjoy ka at hindi ka mapapagod. So thank you very much. That ends up our week 3 online feedbacking on health. If you have any questions, contact me at my Facebook, Sir Nick Cruz. So we then urge you to pass your summative test 1 result and your performance task 1 and 2. That ends our day. Thank you and God bless.